The Ministry of Health, commonly abbreviated to MO, is the ministry overseeing the healthcare and health policy of Saudi Arabia. The ministry is tasked with formulating strategies to ensure public health in the country, while also managing crucial health infrastructure. The ministry's origins can be traced back to 1925, when a number of regional health departments were established, with the first in Mecca, Saudi Arabia. As the country grew economically during the 1940s, the Saudi government created the first National Ministry of Health in the country, appointing Abdullah bin Faisal Al Saud as the kingdom's first Minister of Health. During the next couple of decades, the ministry oversaw the development and construction of numerous hospitals and regional clinics. As the Kingdom of Saudi Arabia economy grew in the 1970s and 1980s, so did its healthcare requirements. During this period, the MO oversaw the construction of hospitals in major cities and other health centers in areas with smaller populations. Tawfiq Al-Rabi'a is the current Minister of Health, and has held the position since May 2016. In 1925, Saudi Arabia's first public health department was established in Mecca. The department was founded with the aim to increase the quality and access to healthcare in the country. In the first few decades of its existence, the ministry focused on the development of hospitals and other healthcare infrastructure in Saudi Arabia. Additional regulation was also added, with healthcare centers enforcing regulations to provide necessary standards for practicing medicine and pharmacology. A public health council was also established to address the growing need for healthcare services, and it was the highest level supervisory board, overseeing all aspects of the country's healthcare services. The various healthcare institutions were merged to become a ministerial body in 1950. Abdullah bin Faisal Al Saud was the first health minister and served in the position for 3 years, with his main role to set up the newly formed ministry. He served in the position for 3 years. He was replaced by Rashad Farong, who was personal doctor of King Abdulaziz, and he served in the post between 1954 and 1960. Following World War II, Saudi Arabia's oil production increased dramatically, and many remote areas began to see an influx of workers to work in the oil industry. This meant that developing regions in the kingdom required more healthcare infrastructure, which was subsequently provided. The initial management of this expansion in the early 1960s fell under the responsibility of Hassan bin Yusuf Nasif and Hamid bin Muhammad al-Harsani, the third and fourth ministers of health. They each served a year in the position, from 1960 to 1962. Later in the 1960s, the growth turned the country into a regional and global power, following a number of conflicts in the 1960s and 1970s. Saudi Arabia's importance in the region grew. This continued rise in wealth meant that huge investments were made by the country's leaders in order to improve the standard of living across the country. Health in the rural areas of the country became more accessible during this period, as communities that were once considered rural were more integrated into society with the expansion of oil fields. This expansion required health facilities, which saw the first major rural expansion of medical care in the country's history. This was overseen by Dr. Yusuf bin Yaqub al-Hayri and Sheikh Hassan bin Abdullah al-Sheikh, both of whom served as ministers of health in the mid to late 1960s. Cities such as Riyadh and Jeddah saw their healthcare infrastructure grow substantially. The expansion of the city infrastructure was essential, with urbanization increasing in the country, with large corporations also moving their offices to the country with the growing economy. This early development was overseen by Dr. Jamil bin Ibrahim al-Hujalan and Dr. Abdulaziz bin Abdullah al-Kuwaiti, who served as ministers in the early 1970s. The economic expansion did not only lead to the development of hospitals for citizens but also care for the kingdom's military. In the 1970s saw the construction of Riyadh Military Hospital and many other major infrastructure projects that led to more accessible healthcare. A number of years later saw the creation of King Khalid University Hospital was also completed. Dr. Hussain bin Abdul Razzaq al-Jazairi played a major role in the kingdom's improved hospitals during his 8-year tenure between 1975 and 1983. Towards the end of the 1990s, Dr. Faisal bin Abdulaziz al-Hujalan finished serving as Minister of Health after 12 years. He to this day is still the longest-serving Minister of Health in Saudi Arabia's history. Al-Hujalan's role as health minister was complex and varied. The health of the military and the people during this period was hugely important. Due to the conflict surrounding Iraq's invasion of Kuwait and the surround